Hi, my name is Michaela, and today I'm going to tell you how to perform the basics of CPR. What is CPR? CPR is the cardiopulmonary resuscitation life-saving technique. It is used to restore oxygen to the blood and blood flow to organs to get the heart going and whatnot. It also saves lives. CPR certification is something that is required to perform CPR. You don't necessarily have to know it, but if you are certified, that does bode a lot better in case of emergency. You can get registered online and certified. You can also take in-person classes. A lot of employers will provide these classes for their employees so they are well trained. The classes aren't that expensive, and neither is certification, ranging from $20 to $30. It is also recommended that you make sure your certification is up to date, so renewal might be necessary as well to retake the class and stay informed on the best way to perform this technique. Step 1 of performing CPR includes laying the person down on a flat surface to make sure that you can easily assess their condition. Once you can assess their condition to see if they've stopped breathing or their heart has stopped pumping, you call 911. The dispatcher at 911 center will probably tell you the best way to proceed with what you are doing. A lot of times they're willing to coach you through the steps of CPR if you don't know them already. Step 2 is to see if the breathing has stopped, and if it has, you need to pump the chest. Pumping the chest can be done by putting the heels of your hands, one on top of the other, on the chest in the center of the chest. You need to pump hard and fast using all of your body weight. A lot of techniques that have been used lately have been toward the beat of songs, the most popular being Staying Alive by the Bee Gees, which is kind of ironic. Step 3, you need to check for the breathing again, and then if no breathing is evident or if they're gasping, which is not considered normal, you need to tilt their head back, lift their chin, pinch their nose, and then make mouth contact. As you have mouth contact, you need to blow air down their airway. The position that you have just created should better allow for this. Also, you will probably have to repeat steps 2 and 3 in intervals until help arrives. And then also, The Office did a very funny little video on CPR and explaining how it's done. I just included this for fun.
Alright.
So, assessing the situation, are they breathing?
No, Rose. They are not breathing. And they have no arms or legs.
No, that's not part of it.
Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there?
I would want to live with no legs.
How about no arms? No arms or legs is basically how you exist right now, Kevin. You don't do anything.
Alright, well, let's get back to it, because you're losing them. Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
How's that gonna help you?
I will divide and then count to it.
Right.
Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, I do. I love that song. First I was afraid, I was petrified.
No, it's Staying Alive,
Okay. Yes,
Staying
yeah.
Alive.
You were in the parking lot earlier. That's how I know you.
Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk. Music loud, women more, been kicked around since I was born. Well, it's alright, it's okay. You can look the other way. Let it go, let it go.
I hope you enjoyed that video. That was just for fun. I hope you've also learned how to use CPR and that it might come in handy one day. Hopefully you don't have to use it, but if you need to, there it is. Thanks for watching. And here are the notes from my PowerPoint. I don't really believe in reading off of anything when giving a presentation. I think it sounds too scripted, so I just kind of went with it. But here were the guidelines for what I was going to be talking about.